I was at a soccer practice doing stuff that I shouldn't do at the age of nearly 50. And I lunged for a ball and felt something kind of give in my left hip. And usually I can kind of get up and fake it, but not on that go round.
I'm Jesse Otero, and I am an adult hip and knee reconstruction specialist.
My name is Andrew Racine. I go by Drew, and by training, I'm an occupational therapist.
When I first met Drew, what struck me initially about him was he was a very energetic and physically fit individual who had severe osteoarthritis in his hip.
I started having really bad left hip and groin pain about late 2022. It would flare up, and then it was like this vicious cycle of a flare-up, pain, and then I'd have to lay off. I was at a soccer practice, felt something kind of give in my left hip. Kind of got up, stuck my pride up, and gimped off the field, and then it didn't get better.
Almost overnight, he went from a very functional, athletic individual to almost not able to walk. And as a result, he was suffering. His quality of life was really impaired.
At this point, I'm walking with a limp. Quality of life is down the tubes. Pain is being managed. I'm eating ibuprofen and Tylenol. I couldn't physically do my job anymore. So I was like, I gotta do something. He looks at my stuff and he's like, you're a perfect candidate for an anterior approach hip arthroplasty. He goes, let's do it.
I knew that this would be a patient that would benefit from hip replacement.
I'm like, I need to know that if we do this, like, I'm gonna be back to normal. He goes, absolutely, without a doubt, this surgery is gonna fix your hip and you're gonna be back to doing whatever it is you were doing and more.
I knew that if I did a good job in his surgery, that he was gonna have no problem recovering.
I'm living life. I'm back in beast mode. Playing soccer again, coaching soccer, training soccer players, running, biking, pretty much doing anything and everything I want to do and actually doing it better.
That's why I do this, to see patients go from being almost desperate in need of surgery to the point where they're back to doing all the things that they want to do. That's the best part of my job, is seeing patients in recovery.
He made a promise to me that I would be back to normal, and he delivered the promise. He's a man of his word. He fixed me.